Alzheimer's disease. The DSM-5, Alzheimer's accounts for 60 to 90% of all dementias in the U.S. and is the sixth leading cause of death in adults in the U.S. Every 67 seconds, someone in the U.S. develops Alzheimer's. Alzheimer's is a progressive degenerative type of dementia that affects an individual's memory, behavior, cognition, abilities, and thinking. Going a little bit deeper, the book states it as a complex disease that begins to damage the brain long before the symptoms appear. AD affects processes that keeps the neurons healthy, such as communication, pathways, metabolism, and repair. And with this degeneration of the neurons, it eventually leads to the cell death and brain tissue damage and atrophy. The neural cell destruction and death causes the individual to experience memory loss and failure, persistent confusion, personality changes, and problems with their ADLs. Risk factors. Unfortunately, there is no single significant cause for Alzheimer's, but gender and age are the most significant. Women above the age of 65 have the highest risk of developing Alzheimer's. Other different types is if you have family history of AD, smoking, physical inactivity, obesity, and lower socioeconomic levels have seen, as well as risk factors. There are some genetic theories, which is for early onset Alzheimer's, which occurs in ages 30 to 60-year-olds. They believe that it has mutation in 3 different genes, the APP on chromosome 21, the PS1 on chromosome 14, and PS2 on chromosome 1. But as I said, these are just theories. There is no definitive cause of Alzheimer's. First stage is mild Alzheimer's. The loss of intellectual inabilities are subtle. They have a loss in energy, drive, initiative, and difficulty learning new things. They begin to show short-term memory loss, and they are aware of this and are concerned about the lost abilities. In the second stage of Alzheimer's, it's more of a moderate. So the deterioration becomes evident during this stage. They show progressive memory loss, such as short-term memory impairment and memory gaps. They have issues with their money management, legal affairs, writing, cooking, cleaning. They become socially withdrawn, and the deficits intensify when the patient becomes stressed, fatigued, out of their element, and if there's another infection that is present. The patient is going to need daily care and supervision from their caregiver and family, which could develop caregiver fatigue. Is moderate to severe Alzheimer's, which develops severe agnosia, which is the inability to identify familiar objects, people, family, or spouses. Advanced apraxia, which is the need of repeated directions and instructions to perform simple tasks. They show an increased ADL loss, including bathing, grooming, dressing, toileting, communication. They have an increased loss of reasoning, verbal communication, and language skills. And frustration is common, and you'll see behavior changes such as agitation, violence, paranoia, and delusions. Stage of late Alzheimer's, these patients are non-ambulatory and non-verbal, but they will have spontaneous screaming outbursts. They eventually forget to eat, swallow, and chew, which leads to weight loss and emaciation. They become incontinent of urine and bowel. They return to that primitive infantile reflexes. With the increased immobility, these patients have skin care and risk for breakdown, and they are institutionalized at this point. Stupor and coma may occur, and death frequently is secondary to an infection or choking. There is no significant diagnosis of Alzheimer's. We can do scanning to show the atrophy of the brain, or to do earlier detection, we can do a mini mental status examination. For the treatment of Alzheimer's, there is no cure. It is a progressive and deterioration disease, but they have come up with cholinesterase inhibitors, which prevent the breakdown of acetylcholine, and that is to treat mild to moderate, which basically slows the progression of the symptoms. and those are Razidine, Aricept, and Exelon. For moderate to severe, they came out with Namenda and Nemzaric, which are NMDA antagonists, which are used to regulate the glucosinate and the toxic effect of influx of calcium, which causes neurodegeneration. Treatments for Alzheimer's include sensory interventions, which are music therapies, pet therapies. You have active therapy and structured activities such as social interaction, music therapy, dancing, art therapy. And then you have psychological therapy, which is reality orientation, reminiscence therapy, cognitive behavioral therapy, and structured support groups for not only the patient but the patient's family and caregivers. As the patient condition deteriorates, the outcomes need to be altered to reflect the patient's diminished functioning. The overall outcome for these patients is to promote optimal level of functioning, increased quality of life, and provide supporting care and measures to the patient and the family and caregivers. Thank you for watching.